What's going on, everybody? John Stamper with Dental Cast Productions, and very excited to be bringing to you this video cast from eAssist, stuff that dentists should know. And we have one of eAssist's award-winning dentists with us today. I've got Dr. Joel Gould from Manhattan Beach, California, the South Bay. How you doing, Dr. Gould?
Doing great, thank you.
Awesome. Well, thanks for coming on. Really, really appreciate it. And as you guys can see, Dr. Gould has his own studio there. Does a lot of cool things on sleep apnea. We were just talking about it, all this exciting stuff. So really looking forward to hearing some of his insight today on eAssist and things like that. So real quickly, before we get started, maybe a little tidbit of yourself and your story and how long you've been practicing dentistry and all that good stuff.
Sure. This is I'm going into my 30th year practicing dentistry. 20 years in this location here in Manhattan Beach, and prior to that, I was a dentist in Vancouver, Canada. And I moved down here about 20 years ago, and I've been here ever since. So I do practice general and cosmetic dentistry, and I started at this location in 2001, and just had a steady grow over the last 20 years, expanding, adding some operatories. I took on some extra space about 5 years ago, wanting to expand. I'm fairly new at sleep apnea treatment, so that's kind of my passion now. I'm moving into that, and took on some extra space to be able to do that. So really wanted to be getting all of my billing and all that stuff completely done out of the way, so I have some time for my new interest.
Yeah, I love that. Very, very exciting stuff. All right, so let's get into it. What's one of the biggest changes I think that you've seen in your practice, especially with a lot of the expansion and the things that you've been doing since using eAssist and starting with eAssist?
Well, one of the real reasons we started to be interested in eAssist is that, I went from one dentist practice in this location, and as it got busier, I added an associate dentist, and then, now you start to have one and a half or two dentists. The billing starts to get complicated, and even though this is a sort of a busy dental practice, it's still very insurance driven. And our biggest issue was that the claims were starting to add up, and adding another dentist, it was a little bit difficult for my staff or my team to make sure we're keeping up on everything. And then there was the follow through as well of the claims that were getting covered. So we knew that we needed to do something.
Right.
And eAssist, we wanted to know what would it be like to have a professional company to help us with that.
Well, and as you know, Dr. Gould, in a lot of cases, as a practice owner, there's either that maybe one event, or like you said, a series of events that really kind of put you in that path. Is okay, it's time that we do this. We're having some struggles, some challenges, but was there any moment that you can recognize where you realized, okay, it was time to kind of move forward? Or it was just kind of a culmination of, like you said, some of the new additions to your practice?
Well, in my practice, everyone has their main job or what they're responsible for, and then they'll have secondary duties. So when one person is in charge of doing all the billing, usually everyone defers to that person. So it ends up being a very highly specialized position. And the issue is, if that person needs a break, needs to take time off, is ill, so now all of a sudden your main insurance biller, someone that's supposed to be putting these claims in every day, is now not in for a couple of days. By the first or second or third day, things are really piling up. And if you don't have a second team member who's available to start doing billing immediately, this begins to be a headache for the person coming back. So really, if you're watching this, probably not a surprise to you that taking the idea that one person in your practice could actually have the stranglehold on all of the finances, all of the money that's supposed to be coming in, it can be an issue, because people are human, and they're going to have sick days. There's going to be days where they're maybe not performing to the level that they need to. In this case, I think it was somebody who maybe even gave notice that they were no longer going to be with us. And I think that probably over the years, I've replaced different people. I'll have an insurance biller that will last for a while. But this was really a different feeling, taking what is the most critical part of dentistry when you're dealing with these insurance companies and automating that.
Right.
And I think that the skills and the knowledge that any individual person can have, even if they're a good insurance biller, really can't compare to a company whose main job is actually billing insurance companies. It's a sort of a different level of competency, because someone can have a bad day, but a group of people generally will have protocols that will help not be, miss whatever submissions. Because, insurance company, they really just don't want to pay on claims, and they'll take any excuse possible to deny a claim. So having someone who's really focused on a regular basis can really help.
So were you doing this in-house before you started using eAssist?
Yeah, I've always done my billing in-house, and again, it was always possible when you're a slower, smaller, single,
Right.
dental practice, or you have, staff members or team members who've been with you for years. That's great and everything, but as things start to grow and change, it was one of those things where I was really nervous at first about bringing on this outside billing company, and it's not cheap, but it replaces a person, it replaces an actual employee, and the replacement is there every day. They're not having a slow day or a bad day or calling in sick. So it really, I have a much higher degree of confidence that my practice is going to stay on track when I know that eAssist is working with me.
Right. And how has it benefited? And certainly for you as the practice owner, a lot of benefits, like you mentioned. How has it benefited the rest of your team? And maybe some of the things that they've shared in regards to flows in the practice with patients, things like that.
Right. Well, a couple things. Mostly, my team can focus on spending time doing two things that are very time consuming. We have to verify insurance, and we really go through the details, because once we have that information, it makes it easier for us. And that takes a long time. The other thing is that just getting patients in these days is very complex. And
Right.
before we really are going to call to book a patient, we want to know what their fees are. Everyone gets so mad if we can't predict all this stuff. So we spend our time explaining the procedures to the patient, rather than having somebody, doing the 30, 60, 90 days of collections. And, it's nice to have that just professionally taken out of the way. The other big aspect that I like about eAssist is it's decentralized one important aspect of what I'm doing from my front desk. And I'm always worried about fraud, theft, and all these things. I've seen a million different dental practice be stolen from.
Right.
And I think that knowing that the billing has been taken offsite and is being handled and there's scrutiny on it, I think it's a big difference that the likelihood of somebody trying to steal or trying to squeeze some money out somehow is going to, it's going to be much less likely, because we have a totally separate set of eyes working on this. So I think it's quite helpful, and oftentimes they will catch mistakes and they will be fighting for us. And
Right.
that's the other thing I really want to say that we really appreciate, is that in the past, if a claim was denied, I would have to get involved. And now I only get involved if it's really gone all the way down the chain of command, and that now there's something different that I need to contribute to. So I know that I believe eAssist goes to bat for us quite a bit in getting claims that are denied, get them covered.
Yeah. Awesome. All right. So, as you know, in a lot of cases, with a lot of the different services that you have to use in your practice, sometimes it's you find the company and then you decide to go ahead and use that service, or you're out there looking for a company that can help you with this. So, in this particular case with eAssist, how did that happen? Had you made the decision that you wanted to look for a third party to help, or was it that you discovered eAssist first?
I think that this is quite a while back. I'm not 100% that I remember, but
Yeah.
I think that it was at a time when eAssist was a lot smaller,
Hmm.
and that that was what I was presented with. We didn't go shopping around, but
Right.
I can't remember exactly. There were some specific reasons, and I think it was presented in a way that the people who formed eAssist, the ones who created the company, had come from various different dental insurance billing backgrounds, and they were trying to put together all of the greatest assets or all the things that they learned over the years and try and simplify some of this billing stuff. So I really don't think at the time there was a lot of competition.
Yeah.
And I think that we sort of started out small, and that it gave me confidence that these were people who, when I would call, they actually understood
Right.
the billing process. So it gave me a lot of confidence to be using them, because I knew that these were people who could have this conversation with the insurance company. The insurance companies are getting really bad. They have completely non-dental people reviewing claims.
Yeah.
And, just having that extra layer of insulation against the aggravation and frustration that we all deal with these insurance companies. They're really terrible. Their job is to try and not pay us. So I think it's kind of nice to have this professional corporation that knows dentistry that will literally get down into the nitty gritty of billing.
Yeah.
So, I like them for that reason.
Well, and I think in closing, what would be the biggest thing that you would share for any of your colleagues out there, dental practices, a lot of the circles that you're a part of, to some of the other dentists? What would you say to them that are maybe struggling with some of these billing challenges, and a couple of steps in the process to really streamline it the way that you did to help you grow and do different things in your practice?
Right. Well, again, if it's a smaller practice, you can probably get away with having the billing internal, but you know, uh, everyone believes their insurance should pay for everything, and it's just more and more complex. And feel like we're spending more time explaining procedures to patients and trying to get them to accept treatment. And it's just, to me, the best aspect of this is just taking this one thing out of the mix. I guess it's probably a combination. I would say that, if you're at the point where you have such a busy practice that one person is doing all the billing, that it may not be a bad idea to evaluate your practice for something like eAssist, because that one, it doesn't, you don't worry about it until that person calls in sick,
Right.
and then can't show up for day after day. And then, it's pretty terrifying just to know that that one person is literally the link to the money coming to the practice. And I guess I have a level of confidence at using eAssist, because I know that billing is getting done, whether someone, no one's having a bad day at eAssist, or hopefully not that I know of. So I know
Right,
that
right.
that if someone calls in sick, someone else is going to take over my claim. So I guess I just like the confidence that I've had of knowing they do a great job keeping my over 60-day accounts receivable very low. There should almost be nothing in the over 90-day, and they really do go to bat for me. So just, I guess, the feeling of confidence that these guys are looking at my claims and they know what they're doing, and that I have the confidence that I'm getting paid properly.
Yeah, and I just thought about this as you were kind of talking through it. Uh, how about from a patient perspective, right? I mean, when you went down this path, was there anything different from a patient perspective, in the sense that, I mean, obviously, I know a lot of cases this is to make sure that you and your team and your providers get paid, but is there anything that you saw that by making this decision helped on the patient side as far as getting some of these things handled, or was that?
Well, yeah, definitely the claims that get disputed get handled quicker, to my knowledge.
Yeah.
Number one. Number two is, I think that because eAssist keeps us up to date on what's billable and what's changed, that maybe when we're presenting treatment plans to our patients,
Right.
maybe they're more likely to be in compliance with what we think we're going to get.
Yeah.
So having eAssist keeping us aware of different changes, what's covered, what's not, and then when there's a consistent problem where more than one or two claims start to get rejected, then we can actually make a change in our infrastructure here and know that when we present treatment, that we can say, this particular insurance company, they're denying a lot of this aspect of the treatment.
Right.
They're saying it's not a covered benefit. So when we present that, we're less likely for a patient to be upset if we warn them in advance that the insurance companies are not necessarily covering this procedure. So it can help in that way.
Yeah, because as you know, from a patient perspective, a lot of times it is a who knows, right? Who knows what the insurance company is going to cover? I
Yeah.
know, I go to the office. I always have, such a level of respect, and there's that credibility with you and your other providers to say, hey, we recommend this treatment, and patients want to get it done. But yeah, when you don't understand where things are on the insurance side as a patient, it makes things, very, very difficult. So to know that you and your team have confidence is pretty cool. So awesome.
Yeah, no, it's good. I've been very happy with them.
Good.
And when we've had issues, when we call, they're very attentive. So I couldn't be happier with the company.
Awesome. Well, Dr. Gould, thank you so much. I know you're probably on your lunch break and seeing patients, so we don't want to keep you too much longer, but really, really appreciate your time and sharing what your experience is like. And best of luck in your new ventures,
Sure.
podcasts and sleep apnea and all that awesome stuff.
Sure. Thank you very much. I appreciate it.
All right, you got it.
Okay.